Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. You can also find me on YouTube on the channel at Paul's Heart, PaulsHeart. This video is in response to a question that I received after one of my prior videos in regard to my heart surgery that I had. That was as a result of a late developing side effect from my cancer treatments 36 years ago. This video itself actually will be helpful to anyone, regardless if there's a cancer history or not, if you've undergone open heart surgery. I do want to be clear, this is my experience only, that clearly everybody's individual results may be different as far as things that may be offered. My intent is just to give you an idea, maybe perhaps give you some tools to help yourself navigate or advocate through recovery of heart surgery. There are actually two different types of heart surgeries that you can have. Open heart, which is what resulted in this scar here. And then there's also what's considered transcatheter angioplasty. There's a whole bunch of names for it where they do whatever heart repair they can do through an artery, through an arm or through a leg. But of course, for this video, I'm going to be referring to open heart surgery. It's the biggest, the scariest, and yes, probably the most difficult to recover from. There's no practice run for something like this. You wake up after having it done, and what you got is what you got. Everything is, you're recovering from there. And one of the biggest things to recovery from open heart surgery is pain management. And what I can't stress enough is to not be a hero. Okay, if you're feeling pain and the level of pain medication that they're giving you is not strong enough, ask for something stronger. Don't be a hero. Okay, don't feel you can't complain. Bring it to their attention, because number one, the more pain that you remain in, the more likelihood, the more stress you're going to have, which is going to impact your vitals, and can actually psychologically impact your recovery. Once you deal with the pain, then you get discharged from the hospital, you get sent home with home care. You have restrictions. If you're of driving, if you have a driver's license, you probably got a driving restriction that could be anywhere between 6 to 8 weeks. You need to be cleared to drive by your doctor. At least I prefer that. Again, you want to make sure, because you're trying to steer a steering wheel, and it all hinges on this breastbone. If you have open heart surgery, you don't want to be turning your wheel and crunching this area with a turning maneuver. So I would listen to whatever recommendation your doctor gives for that. At home, they'll give you probably advice on going for walks. You're not going to do anything crazy as far as exercising goes. They'll ask you probably to monitor your blood pressure, your pulse, obviously your weight, but just going for walks. And once you hit your 8-week mark, most likely you should be offered cardiac rehab. And I can't stress enough the value that cardiac rehab has. Now, at the age of 42, like I was, insurance didn't want to pay for it, and actually the doctors didn't feel the need to offer somebody young and sturdy that they would need it. And I can't disagree more with that. I've actually gone through cardiac rehab 3 times, as I've had 3 heart surgeries. 2 of them were repairs through an artery in my leg, and then of course my bypass that I had. But cardiac rehab is valuable, because basically what you're doing is you're going to a medical gym, okay, and they will connect you to a portable heart monitor, And while you're doing anywhere between 1 to 5 different exercises, whether it's a hand bike, standard bike, treadmill, elliptical, whatever, you've got somebody behind a desk monitoring your heart as you're doing the exercises. So for the 12 weeks that you go, if you're able to go 3 days a week, they monitor what your heart does as you're exercising, and then eventually, you graduate once you complete, that term. From there, you can request, physical rehab. This was a major trauma to my body. And so, whereas I felt I was in physical shape prior to the heart surgery, I didn't want to take a chance on re injuring this. So, I did request physical rehab, which I was denied. But I took what I learned in cardiac rehab to, go at any kind of physical training afterwards. I can tell you that cardiologists and thoracic surgeons don't want you doing any kind of upper body work. I don't know for how long that was, but I was recommended not to do that again, putting a lot of stress on the heart as far as your recovery goes. So most of the exercising that I did, which would be considered the physical rehab, was walking. I did have a couple of stretching exercises that I tried to do to, gently stretch out the chest muscles without putting any pressure on the breastbone itself. And once you get to a certain point where you can be cleared, by your doctor, there probably isn't much limit to, any kind of exercise. Now, as far as my recovery was concerned, it was a little more complicated than that because of the amount of radiation that I received 36 years ago. And that actually would play a major role in the recovery of the bone healing itself. So whereas normal recovery for an open heart surgery would probably be 6 to 8 weeks, my recovery was estimated at 6 months to allow the breastbone to fully heal. But as you can see, I have recovered. I was driven to get better. One of the things that I missed most was playing with my daughters who were 3 and 5 years old at the time, not being able to pick them up, things like that. So that was my motivating factor for wanting to, follow the rules, get better. As far as diet goes, I wasn't really put on any kind of special diet. The only thing I was advised against was anything high salt, high fat, which of course would cause, the potential to cause fluid retention, which you don't want. But that's why you weigh yourself also to make sure you're not having any crazy, weight fluctuations. But that's pretty much all that was involved with the heart recovery. I will tell you that the two transcath procedures that I had, one was to place a stent, and the other was to replace my artificial valve, which I've shown before. Those recoveries obviously were much quicker since they were really it didn't go through my breastbone this time. There wasn't really any structure to heal. It was a matter of just give me 4 or 5 or 6 days just to give my body a chance to bounce back, and completed the cardiac rehab again, and eventually would go back into exercising. But that's how I got through my cardiac recovery for my bypass and the other 2 surgeries. If you have any questions that you'd like to ask us in regard to this or any other part of my cancer survivorship, please feel free to drop a question in the comments and I will get back to you. Until next time, this is Paul's Heart.